There've been some enormous gatherings of people, and I'm really curious about what people need to keep in mind to avoid coronavirus and COVID-19 when they're in huge crowds of people.
Same will apply. Basically, wear your mask and as much as you can stay from each other. And these are two separate issues. So Margaret, if you allow me to explain, yes, if we increase mobility and we increase crowds, we will increase the circulation of the virus. No doubt, scientifically, that's true. But at the same time, what we have seen in this country, I'm angry and upset, and I see what the demonstrators are standing for. I stand with them, and Black Lives Matter. And it's very important to remind all of us, this is a public health issue, racism is, and we should speak up and we should not accept it. And I will even add, Margaret, that today we have over 107,000 deaths from COVID-19. But in my opinion, racism is more dangerous to my country than COVID-19.
We have these twin crises going on at the same time, both of which are public health emergencies. And it is, of course, something that people know to wear masks, but they can't realistically stay 6 feet apart. So what's the best you can offer us if people are going to attend a protest? What's the best thing we can do for ourselves and each other?
As much as you can, stay away from each other, especially when you are shouting. When you take your mask out and you shout, please be careful and stay away from each other if you can. And, you know, I know a demonstration, you have to be close to each other. And I know that it's the right thing to do peacefully. That's our right as citizen, especially when there is injustice. And yes, you know, it's not enough at this time to be anti-racism, but you have to also fight it as well.
I'm curious if people have been to a lot of places where there are other people around. Should they consider getting a COVID test?
I would rely on the public health system, and I'm talking about King County now. If we have a case and do the proper tracing, and then be able to know where you were at what time, in order when we reach out to you and say we have an exposure in that place at that time, we know who was there and we can trace them. And yes, they need to be tested if there is a positive case. But mass testing right now, because you participated in the demonstration, I don't see it yet until we start seeing positive cases among people who have demonstrated.
Okay. There are police responses all over the country that involve irritants, whether it's flashbangs or tear gas or other things that are irritants to the lungs at a time we're seeing this respiratory disease. Does being in that environment make you any more vulnerable to the virus?
We don't have any data on that. We don't know if any of these will increase your susceptibility to the virus or not. Unfortunately, we don't have any data on that. So, but again, being careful is all what you can do is be careful and reduce your exposure to any chemical, and be as careful as you can when you are demonstrating.
Is there anything you can offer us in terms of data that there's been any sort of setback because of these large gatherings, or is it too soon to tell whether people might be, you know, infecting one another?
It's too early to tell. But again, Margaret, at the same time, I don't want us, even in the population health business and public health business, to use this COVID-19 in order to tell people you cannot peacefully demonstrate against injustice that you see in your own community. I stand with them, I support them.
How do we support each other's emotional health during this time? As I mentioned, there are dual crises right now, both of them existential, in the midst of massive unemployment and unrest. And how do we help each other on an emotional level?
It's becoming more difficult than before. I mean, what we have seen throughout the past days have put all of us on edge, and we are all struggling with it. I mean, I deal with it myself. It's very hard. I see it in my daughter who is crying a lot, my wife, we all are suffering, everyone. And then when I look at myself, I'm one of the lucky ones who has a job and still can work from home. So you could imagine the impact on everybody else in our society. Our students are suffering at the university. Our staff are suffering.
Well, if ever we needed each other,
This is
it's
the
right
time
now.
to be together. Yes. Thank you.
Gotta stop making me cry, though, really.
No, you know, it's very hard. We have told our staff, you know, we know this will impact productivity. We have told our students, some of them have finals now. It's very difficult. So we're telling, you know, no student will fail this semester, this quarter. It's very hard not to be a human being today and stick to science. It's very hard to come to your show and talk to you about numbers only. These are human lives today. We're all struggling. I'm worried about mental health. I'm worried about depression. I'm worried about anxiety, because all what we are seeing right now about this police brutality that we should not stand for, it came on top of COVID-19. Even before COVID-19, this is something unacceptable, and we are tired from demonstrating. We are tired from speaking up, but we have to.
Well, we're all human first, right? Let's
True.
just try to be that.
Thank you.
Thanks very much.